My concept map this week, I actually highlighted and color coded everything to make it easier to follow. Um, so the 6 clinical models were syndrome of inappropriate antidiuretic hormone secretion, diabetes insipidus, hyperthyroidism, hyperthyroidism, Cushing syndrome, and Addison's disease. And these are all altered hormonal and metabolic functions. The syndrome of inappropriate antidiuretic hormone secretion is a condition of excessive production and release of ADH despite changes in serum osmolality and blood volume. It has excess circulating fluid within cells that increase total body water concentration and eventually dilutes the sodium concentration in the extracellular space. For the clinical manifestations, they are concentrated urine output, serum sodium levels are less than 115. You have anorexia, nausea, vomiting, headache, muscle cramps, and disorientation. To diagnose this, you have to have serum sodium that is less than 135, hypotonicity that's less than 280, decreased urine volume, high concentrated urine with high sodium content, absence of renal, adrenal, or thyroid abnormalities. And to treat this, they either remove the cause of the SADH if possible, water retention, IV solutions, and medications. For diabetes insipidus, it's a condition of insufficient ADH that results in the inability of the body to concentrate or retain water. The most common cause of this is impairment of hypothalamic osmoreceptors after trauma. For clinical manifestations, they include excess thirst, large volume urine output, urine highly dilute, loss of fluids, severe dehydration, and shock, and even death. To diagnose this, they look at past history, physical examinations, and lab work. To treat this, they hydrate you with either on your own or IV hydration, and the use of DAVP drug. For hyperthyroidism, it's a state of excessive thyroid hormone. This can result from excessive stimulation to the thyroid gland. Graves' disease is the most common autoimmune condition. The triggering of this event is unknown. For clinical manifestations, this includes enlargement of thyroid gland, excessive metabolic rate of the body, weight loss, sweating, heat intolerance, agitation, diarrhea, palpitations, and oily skin. To diagnose this, they look at patient history and physical exams. To treat this, they reduce the thyroid hormone levels. They use medication and sometimes full removal of the thyroid gland. For hypothyroidism, it's a state of deficient thyroid hormone. This can result from deficient thyroid hormone synthesis, destruction of the thyroid gland, or impaired TSH. Clinical manifestations include fatigue, weight gain, cold intolerance, dry skin, and constipation. To diagnose this, they look at physical exams and patient history, and they also include lab work. Treatment includes lifelong thyroid hormone replacement therapy or a drug to treat hypothyroidism. Cushing syndrome refers to a condition of prolonged exposure to elevated levels of either endogenous or exogenous glucocorticoid. This can lead to long-term administration of corticosteroid medications, tumors of pituitary gland, and tumors of the adrenal gland. For clinical manifestations, this includes excessive secretion of glucocorticoid, behavior change, glucose intolerance, impaired stress response. To diagnose this, they look at a 24-hour urine collection and imaging studies. To treat this, they remove the cause of the excess hormone production and also medication. For Addison's disease, it's acute ACTH deficiency and adrenal insufficiency. This is an autoimmune destruction of the layers of the adrenal cortex, and this is the most common cause. For clinical manifestations, this includes elevations in ACTH levels, darkening of the skin. It's based on insufficient levels of the steroid hormone. To diagnose this, they use clinical presentations in labs. To treat this, they use a isotonic IV fluid, an improvement of the person's blood pressure, and they also use antibiotics.